Welcome to the Ask the Expert Show with local experts in the field of health, legal, financial, and home improvement. Now, here's your host, Gary Knight.
Yep, I pitched myself. It's not a dream. We are live today on Ask the Experts. Thank you for listening. We have back my friend, and I hope yours. You probably know him. Everybody's listening on the air to the guy I'm about to introduce to you today. Hi, Felix. How you doing?
I'm doing great.
Felix happens to be with the Health and Hospice, so that's Avatar Home Health and Hospice today. And you can call this number. Is this number answered only by you, or is it?
Yeah, correct. That's only by me.
But I can say 281-703-8050 is the number after 12:30 today.
Right, yeah.
Okay. Well, let's get started. We want to talk about, we've talked about a lot of things. How about doing some general questions about Avatar? Maybe we can start with the history.
Sure. Well, Avatar Home Health and Hospice started back in 2006.
Mm-hmm.
Seems to me like it was yesterday, but it's already going on, 12, 13 years already?
Something like that.
Right, and we as a home health and hospice agency, we are certified by Medicare, Medicaid. We are accredited by the Joint Commission, and for those of you that do not know what the Joint Commission is an institution that's being allowed by Medicare to be the one that goes out and inspects all the hospitals and other healthcare providers to make sure that they do everything according to Medicare regulations. So only 9% of the agencies in Texas have been awarded the gold seal of approval by the Joint Commission.
Don't tell me you're one of them.
And Avatar Home Health is one of them, and we're very proud of that. And they come out every so often, and they look at all our records, and they question our nurses. They go out with our nurses to make sure that they're doing the right things, that they're following the right procedures. And we've been accredited by them now going on 12, 13 years. So we must be doing something right.
Congratulations on that.
Thank you.
I got a question. Do they also check the cleanliness and all that? Does that fall in?
Everything. Everything. Yes. If the nurses are changing gloves and the nurses, they every single detail. Actually, I'm not an expert, but when I go to the hospital because I have to take a relative or something, or I'm just visiting someone, and I see other nurses, I say, "Oh, you should be happy that Jake was not here because you're not supposed to be doing that." I mean, I don't tell them. I just thinking to myself,
Yeah.
So yes, they're very, very rigorous, and you have to know what you're doing, and you have to do it by the way they want you to do it. So it's all about safety. It's all about patient safety. We have to make sure that we take good care of them, and I mean that's our job.
Okay.
So So going back to the history, we started out with actually 2 employees. The director of nursing and myself. Then we hired 1 nurse, and that was back in 2007. And we grew very rapidly. And today, from that 1 patient, we're taking care of 360 patients or more, maybe 380 now.
Wow.
We don't employ 1 person anymore. We employ 225. We cover all of Harris County and all of Montgomery County. So almost anywhere you live in these areas, we will be able to send a very, very good nurse or home health aide or caretaker to help you. Also, we not only have home health, but we also take care of people with terminal illnesses, and that's a hospice services, which is something very important, very dear to our heart, because we're able to help people when they need us the most. And then finally, we also we have a provider license, meaning that we have caretakers that go out and help the elderly with their everyday needs, like if they need help taking a bath, they need help going to the groceries, they need help, getting prescriptions from the pharmacy, going to the doctor. They do light cleaning, light cooking. So those people spend 2-3 hours a day, depending on what the insurance company or Medicaid, approves. And they go, 3 times a week, 5 times a week. It all depends what the insurance company approves.
and what? So there's a category for somebody out there.
Yes, yes. Whatever your needs are, you can call us. We also work not only with Medicare and Medicaid, but we work with, different insurance companies. So even if you have private insurance,
Yeah.
do give us a call. Most likely we're in network with them. If we're not, we will refer you out to another agency that might be that is in network with those with that insurance company.
But you're a 24-hour admission.
Correct. Yes. Once you call us, we're gonna have a visit from one of our staff members within 24 hours.
Okay.
Now, Medicare requires to be there within 48 hours, but our objective is to be there within 24 hours. So, when you call us, if we can make it that same day, if you allow us to go to your house the same day, we're gonna be there the same day you call us. If you call us late in the afternoon, then it's going to be the next day. But we take pride also in the prompt service that we give. Not only do we go out there when you call us, but if you have a need at 2 o'clock in the morning, you call us, you're going to be talking to a nurse. We have nurses on call 24/7.
Wow.
365 days a year. And, you need help, you're going to get it from Avatar Home Health and Hospice.
I guess you'd have to be 24/7 in that type of business, correct?
Correct, yes.
Okay. Oh, and I was just looking at this. I can say you accept, and I don't know if you got a whole list of things. You probably know it off the top of your head what you accept besides Medicare and Medicaid.
Yes, we're in network with Aetna, United Healthcare, Molina, Humana. Now, keep in mind that with all these insurance companies, they have hundreds of different plans. So with
that.
Aetna, with some of them, we're in network with all their plans. Then you have companies like Humana, where we can help you with some plans they have, and other plans we're going to refer you to someplace else. And sometimes, basically there's no one in town that has that is in network with that particular insurance company. So that's hard on the patient. So before you sign up with an insurance company, you make sure that they do have a good network, or make sure that you actually need that insurance company. Most of our patients are over 65, so all of them, if not all of them, have Medicare. So if you have Medicare, many times the insurance companies are going to call you, talk you into getting into an HMO, and that's not always the best for you. Sometimes it is, but many times somebody might have, like for instance, take a person that has Medicare and Medicaid.
Okay.
So between Medicare and Medicaid, they cover 100%. That is 100% of their medical expenses are going to be paid either by Medicare or Medicaid.
That's great.
So why get an insurance company involved when the insurance company is not really going to pay for anything? They're just there to kind of manage your benefits. So what happens is, if you do not have an insurance company, you can go to any doctor you want. You can go with any home health agency you want. You can be taken care of by whoever you choose. However, when you have an HMO or an insurance company, then you have to call them and say, is Dr. Smith part of your network? Is this ABC Home Health Agency part of your network? And if they say no, you're out of luck. You have to go with a doctor that they tell you. In other words, they're going to give you a list of doctors and a list of providers that you have to choose from.
Okay.
So your choices are limited. So if you have Medicare and Medicaid, my advice is do not sign with an insurance company. If you have Medicare and you don't have Medicaid, but you can pay for what is called a supplemental plan. That is an insurance policy that's going to pay for the benefits that Medicare doesn't cover.
Okay.
They're going to pay for the Medicare deductibles. the Medicare co-payments. So if you are fortunate enough to pay, they cost about approximately $140 a month, sometimes more. It depends what kind of plan you choose. But if you can afford to pay around $140 a month, my suggestion is talk to an agent and get a supplemental plan. But you want to stay with traditional Medicare. Traditional Medicare is very, very is excellent with the freedom that it gives, the freedom of choice that it gives the beneficiaries. So if you have, traditional Medicare, please try to keep it that way.
And you should know, you've dealt with it for many years. And we're talking to Felix Cannibal, by the way, of Avatar Home Health and Hospice. And if you or someone that you care for and take care of the lives of the home health service area, which is Harris County and Montgomery County, why don't you give them a call? And Felix will be on the other end of the line here in just a few minutes. I'm not trying to rush you into the telephone. You're not going to answer it on the air anyway, are you? While we're into a commercial break.
No, I'd rather talk to them after the show.
Right, so but I'll give this number to you now: 281-703-8050. That's for further information. Correct?
Right.
What are we going to talk about when we come back?
Well,
from this
when we
commercial?
come back, we're going to talk about the medical power of attorney, the do not resuscitate or DNR form, and then I'm going to read some testimonials from our patients or our past patients that have written some very sweet notes for us.
I can't wait. You're listening to Ask the Experts here on AM 700 KSEV, the voice of Texas. We'll be right back.
Do you or anyone you know need help with your daily activities, grocery shopping, bathing, cleaning, cooking? If you do, Avatar Home Health and Hospice can help you. Avatar Home Health can also help if you need nursing services and or therapy services in the convenience of your home. If you live in Harris or Montgomery County, in most cases, they can start services within 24 hours of your calling them. Avatar Home Health and Hospice was established in 2006. Avatar Home Health and Hospice is not only Medicare and Medicaid certified and licensed and insured, but is one of the few agencies that has received the Gold Seal from the Joint Commission. This accreditation has only been granted to less than 9% of the agencies in Texas. At this time, Avatar Home Health and Hospice takes care of over 340 patients. Whether it's home health, hospice, or caretaker services, one of their 220 professionals will be assigned to help you. Avatar Home Health accepts Medicare, Medicaid, United Healthcare, Aetna, Molina, Humana PPO, and other insurance companies. They also accept private pay patients. They can also help you find what benefits you qualify for. Most of their services are paid by Medicare, Medicaid, or your insurance company most of the time, without any out-of-pocket expense to you. Call Avatar Home Health and Hospice at 281-703-8050. That's 281-703-8050. Or email them at info@avatarhomehealth.com.
And that's who we are here with, Avatar Home Health and Hospice. Is that correct, Mr. Felix?
Right.
Let's get on with the show. What do we have to share with the audience today?
Yeah, I would like to talk about two documents that are very important for those of us that are, getting up in years. And one of them is the medical power of attorney. There's a lot of misconception about that particular document. That particular document gives the authority to someone that you trust to make decisions when you cannot make the decisions. And that's where there's a lot of confusion about that. Some people think because they have the power of attorney over their mother or their father, they can make the decisions for them. And that is not the intention of that document. The intention of that document is for that to take place when the individual that signed the power of attorney is no longer capable of making their own decisions.
Okay.
There's a myth out there that because people are old, they cannot think for themselves, they cannot make decisions, they're frail, they're senile, and that is not true. We have many, many patients that even though they're ill, they're very lucid, they're clear of mind, they can make their own decisions, and they really know what they want. And the biggest problem that I've run into, because I go out and talk to almost 100% of my patients, I've been at their homes. So if I have 380 patients at this time, I've been at 380 homes. They all have my cell number, which is the one that we give out, the 281-703-8050.
Okay.
And for instance, right now I'm working with a family. They have 3 siblings, and the patient and the siblings are fighting as to what to do with their mom. Do we put him in hospice, home health, put him on a nursing home, and they're not asking their mother, and their mother knows exactly what she wants. And the kids are telling me, no, she doesn't know what she's talking about. She cannot make her own decisions. And I talked to the lady, and the lady is completely 100% lucid. She knows what she wants, and now you have this infighting within the siblings, which if they were to listen to their mom, they would know what to do.
And it goes on, I know.
Yeah, that goes on a lot. So the thing to do is now that you have all your power, all your thinking is clear, designate someone to make the decisions for you that you will not be able to make. So designate them now, and then talk to your family. If you have children, get them all together and say, okay, I have designated Joe or Mary, whoever, to be my medical power of attorney. And then, clear the air and said, when I can no longer make a decision, he or she's going to make the decisions for me. And this is what I want. So then you can go further into what you want. And one of the things that another document that needs to be looked at, or at least thought about, is the DNR, or do not resuscitate. That is a document where the patient says, look, if I have a heart attack or whatever, and you do not resuscitate me. And that happens when a person that's, and people come to that choice. I have a patient, or had a patient, that was on dialysis. He had to go to dialysis 3 times a week. The rest of the time he spent going to one doctor or the other one. Then he would get sick. He would end up in the emergency room. From the emergency room, they would go into the hospital. From the hospital, they would send him to a rehab. And this vicious cycle had been going on for 3 years.
Oh, that's depression right there.
The one day he called me and he said, can you come by my house? And I said, sure. So I went to visit with him. And he asked me, Felix, please, Mr. Felix, please, tell my family that I don't want this anymore. I want peace. Every day I'm to a different doctor. I'm taking like 20 different medicines every day. I'm going to dialysis. This is not the life I want to live. So if the Lord wants to take me now, let him take me now. And then we had a family reunion, and I was there, and we talked. And there was a lot of crying and stuff, but his children understood that his father was suffering a lot, and he wanted out. He says, when the Lord takes me, let him take me. And that's exactly what happened. He shortly thereafter, we transferred him from our home health side to our hospice side. And still at home. All the services we provide at home. So after that, he was with us another 6 months or so. Because that's another myth. People think, well, if I put my mom in hospice, she's going to die faster. That is not true. Actually, studies have shown that people that go into hospice services will live 45% longer. I mean, that final period will be 45% longer than those that do not have hospice service and continue going to the hospital and the doctor, medicines, testing, procedures, and what have you. So the quality of life that a person with a terminal illness has when they have hospice versus when they do not have hospice is tremendously different. When you have hospice, you have peace of mind, you're pain-free or almost pain-free, you're comfortable, you don't have to be going to the doctor's going to come to see you, the nurse is going to come to see you at the house, we're going to have somebody there helping you if you need a bath, change the linens. So your life changes, and then you can concentrate in things that you want to do and, get in order and, and just live the last months or days of your life peacefully. And that's what hospice is all about.
We have about 4.5 minutes left.
Oh,
so
hey.
I know you're smiling.
Yeah.
Testimonial time.
I tell you what, I was in the morning. This morning I went to my office to prepare for the show.
Okay.
And I have a folder with testimonials, and some of them are on our website, avatarhomehealth.com. And I want to read a couple of them. And I tell you, I was reading them this morning. And to begin with, I would like to let you know that I know or I knew all of these patients.
Okay.
And most of them are no longer with us because these were hospice patients. But this is a letter or a note written by the wife of a patient, and he say, and I have to omit the names, of course, but he says, "Thank each and every one from the bottom of my heart. Such an enlightened experience. Feel so blessed with the kindness, respectfulness that her husband and I." This is hard to read the handwriting, but it says, "Such peace within. From the very first meeting with Mr. Felix, our precious nurse Heather, the angel-like Starla, and sweet registered nurse Gloria, it surely takes a very special group. Words just cannot express how wonderful these people are." Wow. The three names I mentioned, those are our nurses and our home health aides that took care of this gentleman on his last few months of life. Another one here come from also a wife. Mm-hmm. And no, this is another thing. This has to do with something we do during Thanksgiving, where we share Thanksgiving dinner with the patients that we know are going to spend their Thanksgiving by themselves.
Okay.
I said, "Thank you for the Thanksgiving dinner. I think of your group every day. You all very so sweet to her husband and herself. I pray for your work and all the people you touch. You all are amazing. I praise your names and your good work. Thank you again for your continued love and work." This patient is still with us, by the way.
Oh, great.
And then this is a note to one of our nurses. It says, this is in Spanish, but I'll translate it.
All right.
It says, "Gloria, thank you for your help in the last few days of my mom. We love you." Then we have another. Do we have time for one more?
About a minute.
Okay, so I so-and-so, I'm 75 years old. I'm very thankful for your service, for the service you provide and then she gives me by Dana, that's our social worker. She's pleasant, caring, and understanding. She gives times to care and make me feel loved, and she's always caring. Thanks, so-and-so. And I could go on with testimonials, but what I want to leave the audience with is that please do not go without help. It doesn't cost you anything. We're never going to charge you. What we're going to do is we're going to charge Medicare, Medicaid, or the insurance company. If they don't pay us, it's our loss. But don't go without help. Call me at 281-703-8050, and I'll be more than happy to talk to you and see how we can help you. And this is any day of the week, Monday through Sunday. You can call me at 281-703-8050. 8050. Oh, by the way, next Sunday we're going to be on at 7 p.m.
Oh,
So
okay.
one Sunday we're going to be on at noon. The next Sunday we're going to be at 7 p.m. Then like that, we're going to alternate one Sunday at noon like today.
All right.
And then the following Sunday will be on at 7 p.m. So please listen in next Sunday at 7 p.m. at the same station.
Thank you,
thank you.
Felix. We'll talk to you later.
Thank you so much.
This has been Ask the Experts.
Thanks again for tuning in for another Ask the Expert show right here on AM 700 KSEV.